All right, welcome back to ABA exam review and the continuation of our BCBA practice questions series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. You, a behavior analyst, design a reinforcement procedure to teach a client a new skill using an ABAB design. You implement baseline and then move into the intervention phase where you notice an increase in the skill that you were targeting. At this point, before moving into next baseline, what can we say for certain has occurred? All right, so let's think about this question. It's not meant to be a trick question, but it can be tricky. Let's think about an ABAB design. What are we doing with an ABAB design? Well, we're essentially reversing or withdrawing our intervention. We start with the baseline, we intervene, we go back to baseline, we intervene again. What is the point of the reversal? The reversal is going to show us or attempt to show us what effect did the intervention have on the behavior. If you have a flat baseline and then you go to intervention and your data increases and you go back to baseline and you drop back down, you can start to, with some reasonable certainty, say you have a functional relationship between your independent and dependent variable. Now, what happens if we don't have the reversal phase as in this question? Because here you've only done baseline and you've only done intervention. So we don't have that reversal. Without the reversal, we can't, with reasonable certainty, say we have a functional relationship just yet, because there are too many other factors that could have influenced the behavior change. So, if we go from baseline to intervention and we see an increase in the skill, what can we say for certain if we haven't moved into the next baseline? A, the intervention is effective. Well, we can't say that for certain. And why not? Because going from baseline to intervention, when we are looking at it strictly from an analytic standpoint, that's what we're doing, we can't yet say the intervention is effective. What if you were teaching your client math problems and on the side, the client was also receiving math tutoring? And let's say the math tutoring was what actually led to the increase in being able to do math problems. We can't say the intervention is effective without more data. B, there's a functional relationship between the IV and the DV. Without that reversal, we cannot claim a functional relationship because the only way we can know the true effect of that intervention, or at least start to get close, because it's hard to 100% know the true effect, but at least have a better idea, is through that reversal phase. See, there was an increase in the skill from baseline to intervention. This is what we know, right? We had baseline, we go to intervention, the skill increased. We know that for sure. And then D, the client will soon master the skill. Well, we can't say that for sure, especially with the limited information we have. So given the information, C is going to be our best answer. Don't try to draw too much from your designs until the design is complete. Julian, a behavior analyst, designs a differential reinforcement of alternative behavior procedure for use with his 8-year-old client who will bang on his walls when denied access to cookies. Julian wants to implement the procedure right away and is set to start training. Which of the following steps would be essential to this type of procedure? Slow down and let's attack this question. We're looking for the step that is essential to the procedure. Now, what procedure are we looking at? Well, the analyst wants to use a differential reinforcement of alternative behavior procedure. And what do they want to do with the DRA? They want to change the client's behavior who bangs on walls when denied access to cookies. So let's think about differential reinforcement. We are putting something on extinction and reinforcing something else. When we are using an alternative strategy, we're teaching a replacement behavior that's going to go in place of the old behavior. In this case, we're looking at banging on walls. So we need a replacement for banging on walls. Now, with differential reinforcement, when teaching a replacement, it can be alternative or it can be incompatible. When it's incompatible, those topographies need to be different, right? Because they cannot occur at the same time. With an alternative behavior, the new behavior, the replacement, can occur at the same time. And that's the key difference. So all those things we want to keep in mind when answering this question. So we want to use the DRA. What steps would be essential? A, each time the client bangs on walls, a response cost procedure should occur. Is a response cost essential to a differential reinforcement procedure? Absolutely not. Response cost is the punishment. It's a negative punishment procedure. It is not essential here. B, whenever the client is denied access to cookies, reinforce the client for appropriately accepting the denial. Okay, so if we deny access to cookies and the client appropriately accepts the denial, well, we can reinforce that and teach that as the alternative behavior. B looks pretty good. C, stop denying access to cookies until a new behavior is chosen. That is not going to help us with the differential reinforcement procedure. We need to give the client an opportunity to respond to one, put the old behavior on extinction, and two, teach the new behavior. And then three, teach a new behavior that has a different topography than the wall banging. With D, we'd be looking at incompatible behaviors. What we're doing here is alternative behavior procedures. So D is not going to necessarily apply. So, what steps going to be essential to our DRA procedure that we want to start training for right away? Well, whenever the client is denied access to cookies, reinforce the client for appropriately accepting the denial. You, a behavior analyst, are a member of a multidisciplinary team working with a couple of children in a school-based setting. The team consists of parents, teachers, speech therapists, and you. During a meeting, the team identifies that the communication goal you are working on conflicts with the speech therapist's written communication goal. What will be the best approach to resolve this issue? All right, so we're trying to resolve an issue. And what is the issue? What do we know so far? Well, we know we have a multidisciplinary team that consists of parents, teachers, therapists, and you. So we're looking at collaboration. We're looking at working as a team. That's where your mind has to start going and why fluency is so important. Because when you're reading these questions, the more you do and the more accurate you get, you're going to start identifying pretty quickly what the question wants to know about. In this case, you're working to identify communication goals, and the team identifies the goal that you're working on conflicts with the speech therapist goal. So you're on a team, you have a goal, the speech therapist has a goal, your goals are conflicting. What do we need to do? A, each of you should implement your plan, take data, and then compare the data afterwards. Well, your goals are conflicting, so that's going to be different than interventions, right? If you have conflicting goals, can we do something before just following through with those conflicts? Remember, as analysts, BCBAs and BCABAs, we have to collaborate. So, is there a step before just going ahead with all the plans and then seeing what happens? Because is that really the most beneficial way to help the client? B, meet one-on-one with a speech therapist to discuss the goals. You could do that, but remember, you've got this giant team, right? Parents, teachers, therapists, and you. You all should be trying to collaborate on these goals together, especially with the parents. Parents should absolutely be involved with the conflicting goals. So C, arrange a meeting with the multidisciplinary team to review the conflict. Sure, this should be the best approach. The team identified the goals as conflicting, get the team back together and come to a resolution. And maybe A is your resolution, but we don't just jump there. We want to collaborate and try to come up with a joint solution first. And then D, inform the speech therapist they must use your goal to be conceptually systematic. Remember, if the speech therapist is not a BCBA and they're not implementing behavior analysis interventions and components, they don't abide by our same codes and ethics. So D is just not true. So what's the best approach here? Collaborate, collaborate, collaborate. Arrange a meeting with the multidisciplinary team to review the conflict. The client is learning to tie their shoes independently. Client receives a token for each step they complete by themselves, and there are a total of 5 steps. The behavior analyst wants to start to thin the schedule of reinforcement. If the goal was to maintain the already learned behavior, what approach would be best? So we have a schedule thinning question, and our goal is to maintain already learned behavior. Now, why is that important when thinning a reinforcement schedule? Well, when you're thinning a reinforcement schedule, what you're doing is you are making it harder to contact reinforcement. You're reducing the amount of reinforcement. There's just going to be less reinforcement for typically the same behavior, which, if you execute too quickly, can really hinder the client's ability to respond. So if you want to maintain the already learned behavior and then the schedule, what do we need to do? Because right now, the client receives a token for each step. Each step they complete by themselves, and there are a total of 5 steps. Each time they get a step right, they get a token, or a total of 5 tokens every time. A lot of reinforcements. We've got to be smart about how we thin the schedule to maintain the learned behavior. So A, move immediately to a variable ratio schedule so that the client cannot predict when reinforcement will be delivered. Well, we got to remember, variable ratio schedules are typically the strongest schedule there is because they are so unpredictable. So if your goal is to maintain the already learned behavior, you want to be very careful about what schedule you're choosing. Moving to a VR schedule immediately might not be your best option. B, slowly increase the number of steps needed to earn a token. Sure, we can slowly change the reinforcement. We can do it systematically, we can do it methodically, we can do it slowly. That way, we are thinning the schedule. We're just not doing it too quickly or drastically. C, start to use an interval schedule to help your client learn to wait for reinforcement. Similar to A, what is going to be the purpose of having them wait for the reinforcement on a timer? Not really helping us obtain our goal in the question. And then D, eliminate the use of tokens and switch to social praise only. Well, there you're making a drastic change in the schedule. We don't want to be that drastic, right? When we're thinning, we want to be smart about how the thinning is approached. So if the goal is to maintain that already learned behavior, we're going to look at B, slowly increase the number of steps needed to earn a token. You, a behavior analyst, are reviewing some data from 2 different behavior technicians for the same client they both saw last week. You start to notice that there are several discrepancies between what one technician recorded and what the other technician recorded. As the supervising analyst, what would be the most appropriate next step from the list below? So you are the supervising analyst here, and what is happening? Well, you're looking at data from 2 different technicians, and it's from the same client. So we would expect that data to be pretty consistent. However, you see there are several discrepancies between what one technician recorded and what the other technician recorded. That's a problem, right? Because we want our data from all the team to be very consistent. That's what we talk about when we talk about inter-observer agreement. We're very much lacking IOA here. As the analyst, what's going to be the most appropriate next step from the list below? A, call each technician in individually and ask them about their mistakes. Well, as far as supervision and training goes, we're jumping way ahead here to just call them in and ask them about mistakes. Maybe they didn't make mistakes. Maybe the way you trained them was different for each technician and they were doing what you said to do. So A makes too many assumptions about these mistakes. B, combine the data and use the average of each technician's data. If you did that, that's not going to be true data. That data is not really going to be reflective of what actually happened. C, remove both technicians from the case and assign different technicians. Well, you can't do that because they're still going to have to do data collection. So we're not just going to put a Band-Aid on the problem, even if there is a problem, which we don't even know if there's a problem yet. The problem may have been how they were trained. So the first thing you're going to want to do is retrain each technician on data collection. You're going to want to make sure how they're taking data is actually the right way to do it. Because if it's not, you're going to be able to quickly figure out the issue at hand. So as a supervising analyst, the most appropriate next step is going to be retraining each technician on data collection. Thank you so much for watching. Check out behavioranalyststudy.com for all of our study materials. Make sure to subscribe for all of our updates. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.